bystander sees an adult collapse suddenly, there are two simple steps to follow. Call 911 and push hard and fast in the center of the chest. Dispatchers or telecommunicators may provide further instructions, including step-by-step coaching on how to perform CPR until trained help arrives.
Some rescuers might find it necessary to provide compression-only CPR until a barrier device is available. The guard begins chest compressions without delay. A second guard returns with an AED. This introduces the next link in the chain of survival. The AED, or Automated External Defibrillator, is a lightweight portable device that can identify an abnormal heart rhythm that needs a shock. The AED can then deliver a shock that can convert a rhythm back to normal.
Most sudden cardiac arrests are triggered by abnormal heart rhythms called arrhythmias. A common and treatable arrhythmia causing cardiac arrest is ventricular fibrillation, or VF. With VF, the heart's electrical impulses suddenly become chaotic and ineffective. Blood flow to the brain and other vital organs stops abruptly, and the person loses consciousness. Death usually follows unless a normal heart rhythm and pulse are restored within minutes. The AED uses voice prompts, lights, and on-screen messages to tell the rescuer the steps to take. AEDs are simple to operate, allowing lay rescuers and healthcare providers to attempt defibrillation safely.
As the emergency medical services, or EMS providers, arrive and take over care, they provide advanced life support, extending the chain to give a person the best chance of survival. Advanced life support can occur in any setting and provides more advanced treatment.
Once the return of spontaneous circulation, or ROS, is achieved, EMS transports the person for post-cardiac arrest care. Post-cardiac arrest care after ROS focuses on preventing the return of cardiac arrest and improving long-term survival. Recovery from cardiac arrest continues long after hospital discharge and includes physical, emotional, and family support. These 6 links show the most important actions needed to treat cardiac arrest.
BLS is the foundation for saving lives after a cardiac arrest. In this course, you'll learn the skills of high-quality CPR for people of all ages and practice delivery of these skills, both as a single rescuer and as a member of a multi-rescuer team. Now, let's go back and review a rescue, focusing on the steps of BLS as they happen.
There are several steps of BLS that you'll need to perform when you suspect that a person is in cardiac arrest. First, scan the scene to assess safety. Then, check to see if the person is responsive by tapping and shouting. If they do not respond, activate the emergency response system and get an AED, or send someone to activate the emergency response system. Next, check for breathing by watching the chest for rise and fall.
Abnormal breaths are common in the first minutes of a cardiac arrest. These abnormal breaths are called agonal gasps and should not be confused with normal breathing. Rescuers can sometimes mistake agonal breathing for normal breathing and fail to recognize cardiac arrest and initiate CPR. Seizure-like activity can also sometimes delay the recognition of cardiac arrest.
If the person has no signs of responsiveness, the emergency response system has been activated with an AED on the way, and there are no signs of breathing or a pulse, then immediately begin CPR starting with chest compressions. The delivery of rapid, strong compressions is a priority, but be sure to deliver ventilation as soon as the pocket mask or bag mask device arrives. Once the AED arrives, it is important to use it immediately. We will go over proper AED use later in the course.
You never know what situation you'll face or what resources will be accessible. It's important to have the knowledge and framework to provide high-quality, life-saving CPR, regardless of the conditions and circumstances.
Now, we will focus on the individual skills that rescuers perform. It is most effective to perform CPR as a team, but to be an effective team member, you'll need the individual skills of CPR. So, we'll start there.
As a healthcare provider, your first step is to assess the surroundings for safety. Then, tap and shout to see if the person responds. If not, you should shout for nearby help or activate the emergency response system in your workplace. Check for breathing by scanning the person's chest, looking for chest rise. Check for a carotid pulse. The technique of feeling for the carotid pulse is usually easier to perform on the side closest to you. Use 2 or 3 fingers to locate the person's trachea and then slide your fingers into the groove just to one side of the trachea.
You can scan for breathing and check for a pulse simultaneously to minimize time before compressions. The check for breathing and pulse should take at least 5, but no more than 10 seconds. If you observe no breathing, abnormal breathing, or only gasping, and you do not feel a pulse, ensure that help is on the way and start chest compressions immediately.
Before you start chest compressions, make sure the person is lying face up on